Last year, over 120,000 New Yorkers slept not in homes but in homeless shelters, and many more slept on the streets unaccounted for. On average, over 39,000 people stay in shelters per night in New York City, over 15,000 of which are children. The rate of homelessness is at the highest it's been since the Great Depression of the 1930s, and is 45% higher than it was 6 years ago. There are shelters for the homeless to stay in, but in total there are only 19,000 beds, a fraction of what is needed. There are 7 centers that place people in shelters, only one of which serves families with children. There are over 1,000 soup kitchens and food pantries in New York City, as well as job training programs and housing assistance programs. However, the problem still persists.
Certain forms of assistance help people who are homeless get back on their feet, such as rental subsidy programs. But with recent budget cuts, 15,000 families will have their rental subsidy discontinued. This forces families to stay in the shelter system for longer periods of time. Factors that force families into homelessness are varied and deep-set within the makeup of our economy. The main causes of homelessness are low-paying jobs, medical expenses, and high housing costs and the lack of affordable housing. The contributing factors for the recent increase in homelessness are job losses and foreclosures. The solutions needed to eliminate homelessness are the same ones needed to prevent its occurrence. Prevention efforts cost less compared to the costs of maintaining shelters and other resources to a growing population. Unfortunately, funding for these needs continues to dwindle on both federal and state levels, deeply impacting the homeless of New York City.
There are a number of nonprofit organizations that address the issues of homelessness. For example, Homes for the Homeless, Care for the Homeless, Food Bank for New York City, and Coalition for the Homeless. These charitable groups provide both direct services and advocacy to help alleviate the suffering of the homeless in the short term and the long term. Unfortunately, they are limited in their capacity to help by the number of volunteers willing to join them. Nationally, this is not a problem, as there has been a rise in volunteerism in recent years. New York City, however, is at an all-time low with regards to number of volunteers and time spent volunteering, ranking 50th out of the 51 largest cities in the country. Reversing this trend by advocating greater community service action in New York would allow these organizations to further their potential. Speaking to a representative of the nonprofit organization, Peer Health Exchange, we see the real significance of volunteers for these groups.
Volunteers are the be-all and end-all of our model. Basically, it is volunteers on the ground who are delivering the knowledge and skills that we promise to give to these students. Volunteers are essential to what we do.
More effective than simple volunteer work might be the implementation of comprehensive service learning in schools that will address the issue of homelessness. Rather than simply working with pre-existing organizations alone, we will create a program that combines service action with a curriculum centered on homelessness. This program we have designed, Homeless Helpers, will do just that. As a college-based organization, the program will bring together like-minded peers to take initiative and dedicate their time not only to community service, but also to both learning about the issue at hand and teaching others about it. The two main goals will be to inform the public about homelessness, as well as to form a volunteer force that can dedicate countless hours working to better the lives of the homeless population of New York City. We plan on preparing our volunteers to be able to go to local public high schools and educate students on issues surrounding homelessness. This will be achieved through structured workshops, each focusing on specific topics such as the causes of homelessness and preventative measures, and resources for the homeless. Our volunteers will also be mandated to complete at least 3 hours a week of volunteer service at local sites such as soup kitchens or shelters, which cater to the needs of New York City's homeless population, They will then meet weekly as a group and discuss their previous week's volunteer service and the experiences and lessons they may have gained from their work. We believe that this program, by informing the public and initiating action, will be the most effective way to help deal with the immediate issues of the epidemic of homelessness in New York City, while bigger and more influential organizations fight for long-term policy changes.